Hi, everybody. Hi, everyone, and welcome back to another episode of Talking Mental. I am very excited today. It's a beautiful day outside, and I'm talking to a beautiful human being, Dr. Keith Hariman, who is a specialist in psychiatry. Keith, man, it's great to speak to you. Thanks for taking the time. How are you?
Good to speak to you, Aaron. Thank you for inviting me today as well. It's lovely to speak to you. And thank you for doing this talking mental thing as well. I think it's something that we should try to normalize the conversation around mental health. So thank you for doing this podcast.
I appreciate that, man. And I kind of want to jump straight into it because um, psychiatry, being a psychiatrist, I kind of want to just delve straight into the deep end because it seems to be, where we begin when we talk about mental health,
Mm-hmm.
especially around Asia. We sort of jump straight
Yeah.
to mental health issues, straight to a psychiatrist. So maybe you could start and give us a bit of an umbrella picture of what is it you do as a psychiatrist?
Right. Okay. So as psychiatrists, we're all trained as medical doctors. So we've been through med school, did the whole internship, and also did a specialist training in psychiatry. The main difference between a psychiatrist, like myself, and also a psychologist or a counselor or a therapist is that as a psychiatrist, because I have a medical license, I am able to prescribe medications, whereas psychologists, therapists, and counselors are legally not allowed to do so. And theoretically, every technique that the psychologists and counselors and therapists use in their sessions, whether this is some special form of psychotherapy, we as psychiatrists theoretically know of them. Though I do think that there are some psychologists and therapists who are much better and more proficient and also much more focused in providing a certain type of psychotherapy to our clients. So that's why we work in collaboration with them all the time. So this is the main difference between psychiatrists and psychologists. And when people go seek mental health for the first visit, when they encounter problems such as depression or anxiety or feeling a bit unhappy, they can do all of that. They can, as in, they can see a psychiatrist or a psychologist or a therapist. It doesn't really matter. But what's most important is we do work together and we do refer to each other when we think that this client needs help from other specialties.
You mentioned that you work together. In what sense? Like,
Yep.
what aspects would you refer out to a psychologist, and in what aspect? I'm guessing, of course, the medication side, but in what aspect are you guys working together?
Oh, I mean, I can give you two very simple examples. So, a while ago, I saw a teenager kid who was appearing a bit upset, and he voiced out certain thoughts about ending his life. Upon a more detailed examination of his mental state and also to talk about being more about himself, it turns out that he doesn't actually have a very genuine, strong suicidal thought. But then there are still some low mood feelings and then difficulty integrating with his peer group and some difficulties at school. And so, therefore, for this case, for example, I thought it was very appropriate to refer to a child behavior therapist or a child psychologist because at the time, I didn't think that he needed any medications, nor did I think that he needed any further input from me, and the child therapist would be better. On the other hand, another lady I saw was a 50-odd-year-old lady. She has a history of anxiety, probably because of relationship issues with her husband and also some health concerns. And the anxiety was so debilitating that she couldn't really go out during the day and couldn't really socialize. And so she needed some medications to help with that. However, I also felt that this lady would benefit from some behavioral therapy and some training, and also some cognitive therapy, so CBT lumped together, to teach her how to manage the anxiety, teach her some behavioral relaxation techniques, and how to change the distorted thinking about anxiety as well. So that's why in this case, I continue to see this lady, but I've also referred her to see a psychologist who can do a more structured session of CBT with her as well.
See, when I get your explanation of how you are combating people's mental health disorders, for me, it sounds really holistic in a sense, right? Like you're looking at it from a holistic perspective, right? I could potentially prescribe medicine if that's what I think might need, what you might need from a chemical balance perspective, or I'm guessing you're getting in more into the scientific side of it, but more also understanding your case and how, from a holistic perspective, they can help. Now, it's a very different conversation when you're speaking with people who have no idea, who have never seen someone like you before. They don't think about you as someone who can approach it in a holistic view. They almost look at it as a treat it now
Hmm.
case, because they want to eliminate their own perception in society as having an issue with mental health. Because having
Hmm.
perception of having an issue with mental health around the world, but especially here in Asia, it is something you don't want to have that dark cloud over you, right? Like you want to get that cloud away
Yes.
from you as quickly as possible because other people are going to see you with it. So it's more of a going to a psychiatrist to get that instant fix, which you and I both know there's no such thing. But how
Hmm.
do you balance that? Like you talked about your holistic approach as approach to someone who's coming to see you for the first time, unsure about their own issues, let alone their worry about the stigma from society. How do you change their mindset to then go, this is our plan, this is how we do it? Like how do you get into that psyche with people?
Well, I guess so. Just to answer your question in two parts first. The first one talking about if someone doesn't know what is wrong with them and doesn't know who to seek out for help. Sometimes, and I've encountered many cases of such. When they come see me, if I think that they need medications, then I can give them medications. If they don't need medications, then I think that they just need a psychologist to do some psychotherapy. Then I will refer on accordingly. And that's why I say we work together all the time, and that's most important. Of course, it's not to say that I only prescribe medications. Some people believe that psychiatrists only know how to prescribe medications and don't do anything else. And at least in the sessions I have with clients, we also delve into a bit of psychotherapy, and we do a bit of counseling as well. It's not just all about medications, but it's just that sometimes if I feel that a psychologist is better and better trained and has more time to work on a specific psychotherapy, I'd rather introduce the client to someone who is more specialized in this rather than myself. So I guess that's hopefully that answers your question about if they don't know where to seek help, like who should they turn to. Your second question about how do we reduce the stigma? I think that the way I try to do it is there must be a reason why people come to see a psychiatrist or psychologist. There, there must be something that's not going on in their lives, whether this is uh, relationship difficulties with their spouses, with their children, problems at work, sleep issues, etc. There must be something that's bothering them. The way I try to reduce the stigma is, first of all, we find a problem and we try to just focus on that problem. And no one likes to have a bad night's sleep every night. No one likes to feel tired, and no one likes to feel unmotivated all day long. So I'd rather first focus on certain symptoms and see how it can help people as such. Secondly, we're also in the way to reduce the stigma is to normalize it in the sense that we live in Hong Kong. We all know that it's a very stressful life. We all know that it's a very busy, and especially now in this current economic climate, there are layoffs happening and there are also cost cutting issues. Everyone, and not just yourself as my client or any specific person, everyone else, they're probably also experiencing a lot of anxiety and depression in their own lives. It's just that we don't see it, nor
Mm.
do they talk about it, but it's actually more common than people think. And so I think when people know that others are struggling as well, they might be more willing to seek help.
No, I mean that's spot on, right? And I think that's the key of reducing the stigma and making sure that people have everyday conversations, because everyone is dealing with some sort of mental health issues, just where you are on the spectrum, right? And like you mentioned, people when they come to see you, however, when they do come to see someone like you, it's normally when they have literally nowhere else to go, and that's what kind of
Yes.
scares me, is that people approach a psychiatrist when they've literally got nowhere else to turn. And one of the big issues is they there's a lot of red flags that they ignore leading up to that point, but also they also ignore a lot of potential resources that they could go and visit or people that they could go and see to help them, um, you know, get over some of those problems before it gets to the point where they need to come to see you. So I guess my question is, do you want, like, how do you fix that problem? How do you fix the psychiatrist being the first port of call? Like, the psychiatrist surely shouldn't be the first port of call, right?
Well, I mean, it depends on the person. The first port of call can be a psychiatrist, can be a psychologist, can be the office. There's many programs on employee assistance programs. It can be that person. As long as we're speaking to somebody about our issues, it doesn't matter if it's not me or someone else. I think that hopefully we have or even a school counselor, if this is talking to someone who's still in high school or university. As long as we get the conversation starting, then most professionals would know where to refer to once this conversation and engagement has started. There's no definite answer as to who we have to go see. You can even be your general practitioner or your family doctor. It doesn't really matter.
Keith, it really brings up a really interesting point, and I totally agree with you 100%. The interesting thing for me, and why I was really excited to have you on, is you're, in all honesty, one of the brightest minds around this topic that I've spoken to in person. And every time I speak to you, you really not only provide a lot of value, but you provide a certain level of comfort, because I feel like you're very knowledgeable. And when you're knowledgeable and your tone, the way you talk about it, it makes you feel more relaxed. Like, oh, it's actually not that big of a deal, and you're able to help me understand it. And of course, with mental health compared to physical health, we fear the unknown, and when you don't know what's going on, it's what creates this huge amount of fear. So, like when I spoke to you, or when I spoke to Jackie, a psychiatrist that you also know, who helped me with a lot of my issues, the ability to tell me what was going on really put me at ease, because he could explain to me what was actually happening. And once I had rational thought of what was going on, it became easier to fix the problem. Now, here's where my question goes, because you are so great, all right? And there are a lot of psychiatrists that are great.
Thank you.
But you're not accessible to a lot of people, right? And I don't mean you personally. I mean the field of psychiatry, right? Like, it's expensive to go to find someone like you. It is hard to wait in line, like, right? So it's hard to go private, or it's hard to go public because of the waiting, how long you have to wait before you can see someone. So the public versus private is a huge issue, but the accessibility around seeing a psychiatrist is a big problem. What can you do? What can you say for people who can't get access to someone like you?
So the accessibility is particularly an issue in the public sector. I think it's because these days there's a stronger awareness about mental health issues, and if you go seek someone in the public sector, the general first port of call is still with a psychiatrist as opposed to with a therapist or a psychologist. And the waiting times, especially for stable cases, well, when they deem stable.
What does that mean?
Every client, when they go seek a psychiatrist outpatient consultation, would have to undergo a form of triage that is normally carried out by a nurse, for example. And on the triage form, we ask certain questions such as, is there a risk of harm to oneself? Is there a risk to others in the community? Is there any psychotic symptoms present in this person? Does the person have anywhere to turn to right now, for example, a psychiatrist or a GP? Once all these scores are added up together, then there's a category of triage. Admittedly, those who are in the most dire need, so I'm talking about those with a very active suicidal thoughts, with no help around, no family, no friends, not seeing anyone right now, those with the highest category can often be seen really quite soon. If you look at the official hospital authority statistics, those category 1 urgent cases can often be seen within a week or so. So if it's entirely, the patients can see doctors as well. It's just that if we're talking about someone who's a bit more quote unquote stable. So the typical example would be someone who might have some problems with insomnia, but that's the major issue, or they might have problems with focusing or concentrating. So, for example, like a potential ADHD case, this could be a very long waiting time. I was just looking at the waiting time from July 2022 to June 2023 for stable cases, which constitute about 76% of new case bookings. The median time of waiting time can range from 19 to 68 weeks. So 68 weeks meaning a year and 3 months-ish plus. Whereas the longest waiting time can be from 57 to about 95 weeks. So 95 weeks being close to 2 years for the stable cases for the longest waiting time. This is the problem with the public sector psychiatrists, specialist outpatient clinics, where I used to work as well. And I can share that, sometimes the waiting time can be pretty long. I agree.
That like scares me just even hearing that. Like, because I have so many questions in my head, right? Like, a lot can happen. Like, even when you mention the urgent in like in a week, like we might not have an hour, let alone a week, right? So I guess that's why people, for something so urgent, who can't wait a week, is that why we're seeing trends of suicide, domestic violence, a lot of these issues around mental health increasing because there is no there's no way around, like because if you can't get into the public system and you can't afford private, in your mind you might feel that there's no resource to help you.
Well, just first as a public announcement first, if anyone has any thoughts of suicide with imminent plans and concrete action ideas, I do urge people, whether this is the client themselves or their family members, and if they don't have a psychiatrist to see right now, I do urge them to be brought to the A&E department as soon as possible if the risk of harm to oneself or risk to others is quite high. So there's always the A&E for severe, urgent, and imminent cases. What you said, though, is true in the sense that some people, when they, at the beginning, might feel a bit unhappy, but then without proper treatment, then things get worse, and then the frustrations and the unhappiness and discontent all build up, and the problem of depression might worsen over time, and so therefore the waiting time does contribute to perhaps contribute to a rising trend of mental health problems in the city. I can't say this is the only contributing cause. There are other reasons why the prevalence of mental illnesses might be increasing over time in Hong Kong, but this could be one of the issues as well.
Yeah, it's quite interesting to hear that, because I think, and I guess I'm talking from a perspective of when I'm speaking with people, whether that's students at schools or just general public or around events that I'm creating, or any kind of just general inquiries around mental health, because I get a lot of those. I get a lot of random messages because there doesn't seem to be a sort of centralized sort of port of call of where to go. You're sort of going straight onto Google and then Googling mental health resources in Hong Kong, and that's kind of at your own peril and your own journey to go and find that. And as someone who had suffered massively with panic attacks, it's hard to get that rational thought and feel comfortable enough to start researching and doing all that. So I feel, once you do get into that rut, that that initial step to go and see someone is so difficult. Um, but once they do and they get into the public system, and let's say they meet someone in the public system, Keith, what happens next?
Well, it depends on the condition and the problem that this patient is suffering. So, for example, if the person is suspected to have first episode psychosis, schizophrenia, for example, um, then the person might have to be followed up a bit more closely, and there might even be caseworkers or nurses that can follow up with the client in the community as well. In other cases, for example, if it's a case of mild depression with a bit of insomnia, for example, that might not need such a strong community input by nurses or community psychiatric nurses, then they might get some medications and might be scheduled to come up for follow-up in a few weeks or so, or even longer. If, however, the doctor feels that a person would benefit from inpatient treatment for one reason or another, whether this is because this person is imminently suicidal or has very poor self-care or is likely to have very poor drug compliance in the community, who's actively psychotic, for example, then the doctor might then consider whether or not inpatient treatment will be warranted. There are many different reasons why a doctor might want to admit someone, but these are the more common reasons why people are admitted into the public sector hospitals these days as well.
Right. Okay. And I, again, still talking about the road to recovery, right? After seeing someone, then, like you mentioned, different paths for different people, different paths depending on what your case is. From your perspective, right? I think it makes a lot of sense. Let's say it was me coming to see you. You've
Mhm.
you've prescribed me based on my history, my however you would have assessed my where I am and delivered me the path to recovery. Let's so to speak. What are you seeing as a psychiatrist um, around different trends outside of the relationship between you and I? Let's say it was between us that affects someone's road to recovery the most? Is it a lot of family issues? Like when you're talking, if you're speaking as a psychiatrist here, what do you see as more of the common trend around the the barriers that are helping, or the barriers around someone um, recovering properly?
Well, I guess, rather than barriers and also facilitators, I think would sometimes be
Yeah,
balancing them both, for example. So let's say, of course, we recognize that having a very strong family support to help someone recover is helpful. The family support not only is someone who is empathetic, but also someone who knows just the right amount of encouragement without sounding too bossy or too didactic. So what I mean by that, for example, is some patients with, for example, with depression, they might lack any motivation or any type or any energy to go do something, and they would therefore hide in bed all day, not want to leave the room, and not even go to work and stuff. Sometimes we need family members, whether this is parents, spouses, partners, or the good friends, just to give them a bit of a nudge and give them a bit of a push in planning out their day. We call this activity scheduling. So whether this is, for example, encouraging someone to go for a walk by the beach, by the park, inviting someone to a gathering with friends, we all know that such type of activities, meeting up with others and exercise, does actually help one's mental state. So these are how family and friends can facilitate someone towards the path of recovery. However, I also know that in some cases, they might actually be a hindrance or a roadblock towards one's recovery if the relationship between the person with the mental illness and the loved ones is not properly taken care of. For example, there's this thing in psychiatry that we call highly expressed emotions, whereby a person might be um, quite critical of someone, or they might give lots of hostile comments, or they might be emotionally over involved. Sometimes in such cases, when you see someone who's depressed and you constantly criticize them and constantly um, give them very hostile remarks and constantly nag them or say that how useless they are, etc., this actually is a hindrance towards recovery as well. So within the family, they have a very important part to play towards one's path to recovery as well.
Yeah, it's so interesting. As soon as you start talking about that, it's literally, I hear that all the time, um, and especially around the youth. There's a lot of barriers around, or what are perceived as barriers around family that students will talk about a lot, and the lack of understanding and the lack of empathy. You mentioned empathy is a big one. Um, for people who, because for people who can't see you or
Mm-hmm.
aren't at the point to see you, what
Yep.
are some? We talked about red flags earlier, but what are some red flags that people should pay attention? So, what are some red flags that people should pay attention to more? So, let me repeat that again. What are some red flags that people should pay attention to more, so that they can address those red flags earlier before having to come and see someone like you?
Okay. So the biggest thing we worry about in psychiatry, of course, is if someone has an imminent risk to oneself or to others, in terms of risk of any physical injuries, for example. And in these cases, there are actually indications for involuntary admission to hospital as well. We take that seriously. That is, it is actually written in the law that if we believe that someone has imminent risk of harming oneself or others, that they can be involuntarily admitted. So these are the top red flags I always hear as well. The other red flags, for example, is if we see someone appear to be actively psychotic. So, for example, they will tell you that they hear voices talking to them when they're alone, or they suddenly believe that everyone in the world is scheming up against them, or someone's following them on the streets, or they suddenly don't seem to quite make sense in what they're saying in conversations. Such things that we're actually quite, they're a big red flag to us. Um, Functional decline is also something that we notice in patients with mental illness. It's not it's not like a red flag that would bounce out immediately, but observing over time, sometimes we see that patients with mental illness might be performing worse and worse over time, whether this is at school, whether this is at work, or even just to handle the basic domestic duties, such as paying bills on time, buying groceries, keeping the house clean, for example. If we notice that there is a degree of functional decline from a person, then this is another red flag that I do start to worry about as well. And I would urge people to bring these clients to earlier medical attention. The last red flag that I want to also mention is whether or not someone is using what we call maladaptive coping techniques. Nominally, substance abuse of recreational drugs and also alcohol as well. Some people, at the beginning of their mental illness journey, might decide to self-medicate with alcohol to calm the nerves, or just have a big drink after one night, or they might even choose to use some recreational drugs such as cocaine or cannabis to stimulate them, make them feel more lively, or make them help cool down and stuff. We do worry about these cases because we do realize that sometimes when you're drunk or intoxicated with certain substances, accidents can happen and one does lose self-control as well.
Mm. Yeah, I mean, and as someone who especially at the beginning, with not necessarily masking mental, well, without even knowing I was having mental health issues, I definitely found alcohol as a great way to mask the problem because, speaking from experience, it was the best medicine in a sense. Which is quite scary, right? Like it was the best medicine in the sense that it was the short term fix. It would make you feel like yourself without any worry for that short period of time. The next few days afterwards just enhanced everything worse. But for that moment,
Indeed.
you can feel that, which is dangerous, right? And understanding who you are and being self aware, but also having um, that support system around you who can go, hey, bro, like let's pump the brakes just a little bit here. Maybe we chat with someone.
Yeah.
So yeah, I definitely understand that and definitely empathize with people who are struggling from that side of it. Keith,
It's a very short term. It's a very short term escapism fix. But then we know that with prolonged consumption of alcohol, alcohol is known to be a depressant, so it does actually raise the risk of depression over time as well.
no, absolutely. Yep. And I can definitely attest to that because that was something that I was going through, especially sort of 5 6 years ago when the problems were at the height at my height. So I understand that absolutely. Keith, I'll kind of finish on this last question, um,
Yep.
and there will be a bit more of a generic question around how you feel we're moving in the sense of mental health as a. You could even look at it from a global perspective. You know, giving you some context around what my question is, mental health was something I was never educated on in school. It was not something
Mhm.
that I didn't even know about. And it wasn't a shame thing. It was purely a lack of education. So it's something that's quite new, something that is quite prevalent in the world due to COVID, which has affected everyone in the world. I do see a lot of negative trends towards bad mental health around the world. Um, how do you feel we are moving in the space of mental health? And do you think, as a collective, we are moving in the right direction? And if we are, or if we're not, I guess the big question is, what was the main thing you would like to see from your own work? What are some things that you would really like to see implemented? It could be a government um, new policy, it could be education at schools, whatever it is that may be. What can we do? And what's one thing that you can think about that will help us as a collective improve our mental health?
I think answering the first question first, the major trends I see in society, um, there's a good thing and a bad thing. The major trends in the sense that I see that there's a potential increase in the incidence and prevalence of mental health disorders, whether this is depression, anxiety, insomnia. So this is, of course, a worrying trend. But the good thing, in a way, is that at least in Hong Kong, uh, partly due to work carried out by yourself, Aaron, and so partly work carried out by other NGO partners, is that there's an increased conversation around mental health. And people are finding it more comfortable to talk about these issues without feeling the stigma behind it as well. The funniest thing I always hear when I, see an auntie that I haven't seen for ages, and then when they see me and tell them that I'm a psychiatrist, they always go, "Oh, ha 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 ha! I should see you because everyone's crazy in Hong Kong." They all say this, but then we're all crazy to the work, and they say this. They say this as a joke, of course, but then at least to a certain degree, it means that they're not scared of seeing a psychiatrist. And I hope that that's something that people will actually understand because, seeing a psychiatrist or being a therapist or psychologist, really, it's just having a conversation. It's not like we're going to sit there and judge you or comment about your looks or comment about your behavior or comment about your thoughts or comment about your job performance. We're here to just initiate a conversation and help try to understand what the problems are and try to understand how we can help you. So at least in that sense, I do hope that this trend can continue, the reduction of the stigma in the society and the normalization of conversation as such. Um, if there's one thing that I hope that we can change society is perhaps even more conversation amongst different professional groups. This comes into mind firstly in the sense that whether this is a peer support group or whether this is just empowering staff to feel more comfortable to talk to their superiors, their supervisors, their HR staff, or if they have an EAP program at work, to empower them and make them feel comfortable to talk about these things. Perhaps because I work in the private sector right now, having moved from the private sector a few years ago, I see more and more clients working in various white-collar professionals. So whether this is lawyers, bankers, accountants, etc., and everyone's struggling as well. It's not just oneself, and there's actually a higher percentage of the people struggling than people think they are. It's just that people don't show them, and you don't know that your colleague is struggling because no one talks about it. Because talking about mental health might seem to be a sign of weakness, that you're just not cut out for it or you're not able to perform. I think that if we are able to at least be more open to talk about this and to be more supportive, I do believe that in the long run, this actually does improve everyone's productivity, improves everyone's work efficiency, improve work satisfaction, and also decrease absenteeism from work. It's just that having this first conversation and making people feel that they can talk about it, I think that's the most important thing right now for us as well.
Mic drop, bro. That was amazing. I literally couldn't agree with you more, and I I think that's a great way to end it. So no, I really appreciate. First of all, I really appreciate your time. I know that you are a busy man, and I see that as like that must be a good and a bad thing, right? You hope one day you're not as busy in the world, but thank you so much for your time. Honestly, not only very appreciative of taking the time, but also the value that you bring with regards to your knowledge from working in different sectors like the public sector and the private sector, the knowledge around what is happening. I really appreciate it because it always fills me up with more value, and I'm really hoping that anyone who's listening or watching to this will be able to get value from that as well. I know they will. And for people that want to reach out to you, Keith, what's the best way for them to do that?
If when they try to type my name on Google, you will see a link to where you can see my name on Google, and I'm sure a link can be found somewhere.
We'll put them in different areas. I'm sure we'll have click here to find Keith, and especially when we're doing any kind of talking mental events, Keith is one of our favorite people to invite. So hopefully, if we have the opportunity again to have the privilege and get Keith in sort of in-person ones, we will be advertising that. I think it's worth trying to make the effort to come along and speak to him in person because he'll be able to answer a lot more questions than someone like I will. So thanks.
No. Thank you, Aaron, for inviting me today. Thank you so much.
Thank you.
Bye. Have a good day. Thank you.
All right, man. Hey, look, thanks so much again. Seriously, I really appreciate it.
Bye. Thank you.
We won't do any Cantonese. 下次啊，我哋下次講中文啦，即係
你中意冇問題。
好，揾個時間講中文啦，下次。
食埋飯都揾個時間。
Yes。
今日冇見你。係
咯，好，我會再揾你啦。
你中意開下個班都得㗎，中意食飯嘅話。If you want。
好啊，即係上面咯。好，我去揾你啦。我知你忙。
一定你冇問題，一定得㗎啦。OK 嘅，我哋必須。
好，你就
我哋錢都食晏嘅。
好
，Thank you。
好，see you。
Bye。Good seeing you。Bye。
Bye。你撳係 leave session 我諗得㗎啦。
撳 leave 撳唔到喎 leave session 我想講。
你撳唔到 leave session 啊？
係撳俾我。I think it can still record.
Damien's still there? How does Keith bounce out?
Do you just stop recording?
Sure.
Or should I just close the window?
Yeah, you could probably. I guess you can.
Are you sure?
等陣啊 Let me ask Dave.
等埋你，慢慢。
等陣。
等埋你，我唔急嘅。
I'm just texting him now.
來。
Oh, there he is.
Oh, hey Damien.
Hey Damien. What's the best
How
way?
do I how do I leave session? I think it's because it's I think it's because it's recording, so I can't click that button. I mean, you feel free to kick me out if you want to. If you want to kick me out, yeah, okay. Okay, so I just close the window then? Yeah, just remove me. No offense taken. You can kick me
Thanks,
out.
man.
Bye. Good seeing you guys.
Bye. Awesome.